Hello, my name is Andres Lopez, and I will be presenting the disease known as malaria today. A verse that I chose that fits this topic very well is Psalms 41:3, which reads, "The Lord sustains them on their sick bed, and restores them from their bed of illness." And I saw this significant because I see how it ties microbes into a biblical perspective. Because although there are microbes such as bacteria, viruses, and fungi that cause diseases throughout the world, we know that the Lord sustains on sick beds, and we know that He restores them from their bed of illness, referring to all people. Moving into signs and symptoms of malaria, we see that one of the most common signs are going to be fever, chills, headache, diarrhea, and a more significant one that is going to play into a role later on is going to be rapid breathing and rapid heart rate. And the reason these two are extremely important is because it's hinting at what's known as hemolytic anemia, which I'll discuss in a few moments. But fatigue is also going to tie into that hemolytic anemia. We also see often that there are signs of muscle or joint pain, as well as abdominal pain for those with malaria. Causative agents that cause malaria is going to be the Plasmodium parasite. Now, the Plasmodium parasite, there's 5 of these that we know cause malaria. These include Plasmodium falciparum, Vivax, ovale, malariae, and knowlesi. The most common type and the most severe cases often are due to Plasmodium falciparum. One interesting fact is that Plasmodium knowlesi is actually carried by monkeys, which are then transmitted by mosquitoes into our bloodstream. Um, Now, the structure of these Plasmodium parasites are single-celled, they are eukaryotic, and they are found in the RBCs or liver of our bodies when malaria is present. Two important factors of the structure is going to be the apical complex and the food vacuole. Now, the apical complex is going to be where the plasmodium attaches and penetrates our red blood cells, and the food vacuole is a structure that digests the hemoglobin from our RBCs, and this is what causes the hemolytic anemia. And we can see that more clearly in the pathogenesis of malaria. The way it often is transmitted is by infected mosquitoes who inject Plasmodium sporocytes into our bloodstreams. And the Plasmodium sporocytes travel to our liver and release what is known as merozoites. Merozoites infect red blood cells and they burst them, which is known as RBC hemolysis. And this is what causes the hemolytic anemia I referred to earlier, and it also causes fever cycles, chills, fatigue, and most of the symptoms that we reviewed. When it comes to epidemiology, 263 million cases of malaria were recorded in 2023. Now, what's significant is that 94% of all malaria cases and 95% of all deaths in that same year were in the WHO African region. The WHO African region refers to mainly Central Africa. The reason it's referred to as the WHO is because the World Health Organization classifies this area as the African region. Half of these deaths occurred in 4 countries. The main countries that we see these deaths occurring in is going to be Nigeria, the Democratic Republic of Congo, Niger, and the United Republic of Tanzania. And when it comes to treatment and prevention, most recommend to follow the World Health Organization's method. Basically, how I mentioned earlier, malaria is caused by infected mosquitoes. So most of these prevention methods we're going to see have to do with preventing exposure to mosquitoes in general. That's done by often the use of nets when sleeping in places where malaria is known to be present. Repellents against mosquitoes is also extremely common. Many recommend to use DIR 3535 or arcaridin after dusk. Using coils and vaporizers is also one method that can help prevent our exposure to infected mosquitoes. Wearing protective clothing also prevents mosquitoes from being able to make contact with your skin. And using window screens is also a main way of preventing mosquitoes from entering households or other areas. When it comes to treatment and malaria, we're going to see three main types of medicines that many health professionals are going to recommend. The first is a complex one to say, but that's artemisinin-based combination therapy medicines. It is tricky to say, but it is often seen to be effective and gives positive results when it comes to treating malaria. The second one is going to be chloroquine, and chloroquine is one of the most effective medicines out there for malaria because it rapidly reduces the parasite load and treats the active infection of malaria. Now, primaquine is the third, and this is often paired with chloroquine because it provides complementary effects against malaria. And it does this by targeting the liver stage parasites, which chloroquine cannot reach. And when it comes to the Christian worldview, communities often lack access to medicines, as I mentioned, and they often lack the required items needed to prevent malaria, which include mosquito nets and clean water. Believers should protect vulnerable populations and support those who have limited resources. This reflects the Christian values of compassion, stewardship, and loving one's neighbor. That is all that I have to present on malaria, and I hope you enjoyed and learned something new. Thank you.